Hello and welcome to the Critical Health Psychology course. In today's guest lecture, my master's student, Lane Tao, will present on a topic which has been my focus for the past 2 years. I've been studying transgender individuals and how they are treated within the substance use disorder treatment facilities, why they are not accessing them. But that's not the focus of Lane's presentation. Lane will take you through a journey of self-discovery and how transgendered individuals are othered within our system, specifically within our public health system. He will also focus on what people who are transitioning go through and the stigma involved around it. We touched on this topic a little bit within our primary healthcare clinic visit, but Lane is very quickly becoming an expert in this field, and that's why I asked him to share his views and his research experience on this particular topic.
I don't think I can do it like this. One moment, let me just... Great. Let's start. So transgender people are mostly people who are dissatisfied with the gender they were assigned when they were born or assigned at birth. The main experience of trans people is that of extreme discomfort or dissatisfaction with the gender presentation they were assigned and raised with. That is to say, somebody who grew up a masculine or boy child might find themselves very dissatisfied with it and quite unhappy with it and want to change various aspects of their presentation, bodily and expression-wise, to fit what they see in their mind. Gender dysphoria presents itself in many different ways in different people. Some of the main experiences of dysphoria are an extreme discomfort with the body that you're developing in and you have to live with. For example, in trans women, trans people who wish to be more woman-like or feminine, there may be a great discomfort with regards to not having breasts or discomfort having large amounts of body hair, a deep voice, and so forth. Dysphoria also arises when people are not seen by those around them as the gender they wish to be. For example, a trans man being addressed as a woman, being classified as a woman, and being slotted into places in society normally meant for women may cause them discomfort. The main and most successful method of addressing gender dysphoria is the process of transition. Gender transition is the process through which a person becomes the person they see in their mind and the person that they're comfortable and happy being. For people who start off masculine, this can mean going through hormone treatments and surgery to become more feminine. Everyone's transition is different, but it frequently involves a combination of changes in mannerisms and behavior, changes in the way a person dresses, changes in the way a person wants to be addressed, and then the biomedical transition, which is a series of medical procedures a person can take in order to change their body to the one they want. It gets complicated, but I'm going to try and simplify the medical component of the transition as much as possible, because the rest is reversible and much more accessible. The main components of a medical transition are hormonal treatments and surgery, all of which should ideally be supervised by medical professionals. Hormonal treatments involve blocking the body's natural production of whichever set of hormones the person doesn't want and injecting desired hormones into the person's body. In the case of someone transitioning to be more feminine, they would want to block natural testosterone production to a safe degree and then inject estrogen into their body. And in the case of a masculine person, they may want to block their body's production of estrogen and feminizing hormones and inject testosterone and masculinizing hormones into their body. The main effect of masculinizing or feminizing hormonal treatments on the body is similar to going through puberty again. For example, the introduction of estrogen into a person's body in very large amounts, say a transition dose, would cause a person's skin to soften, Their fat may redistribute to the hips and waist, and they may start developing visible breasts. The opposite is visible in the case of masculinizing treatments. The voice will deepen due to exposure to testosterone, like it would in any other person's body that overproduces testosterone. The person's body fat will redistribute away from the hips toward the stomach area and to other parts of the body. They may also notice the development of facial hair and more body hair. Hormone replacement therapy, or HRT, is lifelong. Similar to other conditions like menopause and PCOS, if a body is deficient in its ability to produce required hormones, they have to come from an outside source. Surgical procedures involved in the transition process are all aimed at bringing a person's body in line with their identification and self-perception. Sex reassignment surgery, or SRS, is the most significant of these. SRS is a complex procedure which reconstructs the genitalia of a person in line with their internal sense of self. The methods will vary, but a phalloplasty universally constructs a penis for the person out of grafted tissue or donor tissue, and more modern methods can produce a penis that is fully capable of erection, urination, and sexual sensation. A vaginoplasty converts existing genitalia, normally a penis, into a vaginal canal, ideally with a fully operational urethra and clitoris. SRS is significant because it addresses a core component of many trans people's dysphoria, and if it's paired with the removal of the ovaries or testes, it can stop the body from producing undesired hormones. This removes the need for lifelong hormone blockers. At that point, the person only needs a lifelong treatment of hormone replacement therapy. A range of other surgeries can also bring a person's body in line with their self-perception. Facial feminizing or masculinizing surgeries can alter the facial structure slightly. Testosterone exposure will naturally lower the pitch of a person's voice, but in the case of transfeminine people like myself, I would have to undergo extensive coaching and possible surgery for my voice to be the one I want. Likewise, transmasculine people with breasts may want to remove them, as no amount of testosterone can remove breasts that have already developed. The blanket term for HRT, gender therapy, and transition-related surgical procedures is gender-affirming healthcare. That is, healthcare procedures that affirm a person's true gender, the one they wish to be inside. What does this mean if you're in South Africa? Well, the rights of transgender people in South Africa are incredibly comprehensive. The application of those rights, as with many other areas, is poor. Trans people's rights are enshrined in the Constitution and are legally non-negotiable, but in practice, discrimination and exclusion of trans people is massive and widespread. Access to gender-affirming healthcare supplied by the government is also nearly non-existent. The disturbing reality of transitioning in South Africa is defined by a single question: how deep is your wallet? Gender-affirming surgery in South Africa is almost entirely limited to sex reassignment surgeries performed at Groote Schuur in Cape Town, with a waiting list of 20 to 25 years. I have no knowledge of government-funded sources of facial feminizing or masculinizing surgery or chest surgery. As with many other areas of healthcare in South Africa, the South African government fails to meet its obligations to transgender people to provide life-saving medical care. Private healthcare offers vastly more options. Hormonal treatments are prescription medication that can be obtained from many private doctors around the country. Some doctors will require therapy and referral letters from mental health practitioners. Others will work on an informed consent basis. If you can sign the informed consent paperwork, they'll provide you with a prescription. The majority of medical aid providers in South Africa do not cover HRT, and the current situation is that you'll pay out of your pocket for it for the rest of your life. Some medical aids will cover sex reassignment surgery, most of them do not. Other surgical procedures besides SRS are generally classified as cosmetic and are not covered by any medical aid or government healthcare, period. And so I return to the grim question I asked earlier. How deep is your wallet? Surgical options are as wide as a person can afford. Wealthy transgender people will seek out extraordinarily expensive healthcare overseas if it means safety and better results. Some of the favorite destinations include Thailand, South Korea, and the USA. The USA is a world leader in facial feminizing, masculinizing, and breast augmentation surgery. South Korean doctors have pioneered low-risk, non-invasive voice feminizing surgery, something I am very interested in. And Thailand is known for being an affordable destination for high-quality plastic surgery and sex reassignment surgery. I'm short on time, and I went through this entire presentation describing the processes of transition, but not the importance. So here it is. Transition is suicide prevention. Transgender people consistently rank among the highest risk categories for suicide, and the most medically supported healthcare intervention for addressing dysphoria is transition. Gender-affirming healthcare is not crackpot medicine or a myth. It is a proven source of life-saving medical intervention supported by reputable bodies around the world that makes the best possible use of our medical technology and therapeutic interventions. Every step of a transition brings a person's mental state in line with their physical state. Denying people access to healthcare that is fundamentally life-saving in the long term is abhorrent and awful. I'm also not even starting to discuss the extreme rates of violence, ostracization, and discrimination that transgender people have to endure by virtue of their existence. If I'm talking about a breast augmentation for a transgender person or a chest reconstruction, I'm not purely speaking of cosmetic surgery. I'm referring to a medically safe procedure that has major positive effects on a person's mental health and contributes to a massively reduced suicide risk. I think I've covered the essentials here, but if you're a person who's transgender or just has questions about their gender, one of the best things you can do is to find a supportive community. LGBTQ+ organizations can provide you with friendship, care, and guidance that you might want when you're working out your direction in life. They can certainly help you make an informed decision and support you through whatever your processes you end up deciding to go through or not go through. So anyway, if it isn't clear yet, I'm transgender. 26 or so years ago, a doctor pulled me up, picked me up, and told everyone that I was a boy. The decision was reasonable, but now it's made me very, very upset, and I've set out to change that. The transition process is going to be difficult, expensive, painful. It's a testament to how important it is to me that I know exactly what kinds of discrimination are faced by trans people, and I will walk into it willingly if it means living in a body that fits me and fits what I see in my mind. I hope this whole experience has been educational for you. I hope you've learned something small and something new. And I think my greatest hope is that whoever's watching this gains a small amount of understanding for the challenges that face us.
So, critical health psychology affects all aspects of our lives. As Lane has indicated, it's a very difficult process that transgendered individuals go through to become who they feel that they are supposed to be in their hearts of hearts. And I would like to ask you a question. What is your views on transgendered individuals and the difficulties they face within our system? How do you think you would experience being othered and not having access to health services within our public health system? Why is it so expensive? Why is it so difficult and impossible for people who want to change their identity? What are your thoughts?